It's Dr. Cody Rall with Tech for Psych. I've got such a special episode for you guys today. I talked to Dr. Graeme Moffat, who's the head of research at Interaxon. Now, Interaxon's the company that designed and produces the Muse Headband device. And talking to Graeme was a lot of fun because we got to talk about the history of EEG, how far personal EEG devices have come in the last 10 years, and he even showed me a new device that the Interaxon team is working on that incorporates EEG into a pair of sunglasses. They're working with a prominent Italian sunglass company to make that happen. The interview was a lot of fun to do. I hope you enjoy it. Stay tuned. All right, here with Graeme Moffat, head of research at Interaxon. Thanks so much for doing this, Graeme. Really appreciate it.
It's my pleasure. Thanks for having me on.
And I guess first of all, I just wanted to hear about how you got involved with Muse and the work that you do there.
Yeah, so I really appreciate the opportunity to talk to you and to reach your audience of sort of sophisticated neurofeedback users and enthusiasts. It's not every day that we get to talk to a group that knows something about neurofeedback, and we're not explaining the very basic elements of it. We can get into a lot of detail. So Interaxon got started about 2009, and back then it was primarily an artistic and events company. It was founded by the three co-founders, Chris Amony, Ariel Garten, and Trevor Coleman. And they were doing interactive exhibits where they were taking single or two-channel EEG systems out into the community and having EEG sonification. So they were taking the EEG waveforms and they were translating them into soundscapes and having these collective kind of neurofeedback experiential art exhibits. Those became popular around the Toronto area when they started to do them at scale in the science centers and things like that. And that then was tapped by the government of Ontario to put a big installation at the Vancouver Winter Olympics in which people could, using an EEG system, control the lights on the CN Tower or Niagara Falls or the Canadian Parliament buildings. So from there, in about 2012, the company reoriented toward making a personalized headset. So there was more and more interest in this sort of consumer-grade neurofeedback and people getting more and more interested in their own brains, both from a curiosity perspective and also, a sort of quantified self and personal improvement, personal wellness, and even, cognitive performance perspective. So what that did was that turned into the prototype versions of the Muse Headband. And the Muse Headband's been in the market now since about 2014. So we've been a company in our current form for about 4.5 years, and the Muse currently looks like this. I'll just see if I can.
I've got mine as well.
Yeah. So I've got the white version here, and it pops onto your head, very straightforwardly. And we think that one of the big impediments that we've torn down to bringing brain-computer interface tech and neurofeedback out into the broader world has been just that it's so much easier to put on, and it's sort of intuitive to once you get the hang of it after the first few tries, you can do it every day. And that's a big removal of a major impediment to the popularization of access to brain-computer technology, brain-computer interface technology. Between the advent of the smartphone and the advent of Muse and technologies like it, it's now very easy to put one of these things on, whereas traditional clinical neurofeedback requires a technician to set it up.
Yeah, it's a lot easier, and it's just amazing how the technology sort of downscaled and become more available both in portability and price for people to use. I think it's really taken off because of that fact that people can put their hands on it and get really involved with the technology.
Yeah, absolutely.
So I wanted to ask you what the research at Interaxon looks like. Are there different departments? And then what are you focused on? I imagine part of it is userability, but also there seems to be a lot of work on the actual EEG data itself, and how are you building algorithms for the neurofeedback and that sort of thing?
Yeah, we do a lot of in-house research, and we do a lot of collaboration externally with other companies and with academic researchers in the field. So in-house, we've got a team of researchers, EEG sort of technologists, people who came out of EEG research labs. I myself did a lot of graduate work in EEG. And then went on to some postdoctoral work in animal physiology, and then came back to human EEG when I joined Interaxon. You know, when I started out in EEG research, the state of the art was a 32-channel system running on a giant amplifier that was connected to a desktop computer, and it's come a long way. I wouldn't have anticipated when I first saw the original NeuroSky. It was like this is really not very much, but things have really come a long way in the last 10 years, and so we're now getting into some really, really interesting technologies that have brought the grade of the EEG up, I think.
Yeah.
In addition to
could you talk about that a little bit? How the progression from NeuroSky maybe 10 years ago has developed to where we're at now? Because I don't think a lot of people see. I don't think a lot of people realize that. It seems like these devices have come a long way, and sometimes people compare them back to the original devices, which I don't think were as effective. Okay.
Absolutely.
Okay, good. So we had to change locations, a little technical difficulty, but we were just talking about the progression of these devices from, say, 10 years ago when NeuroSky first came out with theirs to where you guys are at now.
Yeah. So a couple of big things have changed. The first big thing to change was that 10 years ago, when things like NeuroSky first came along, the processing power of mobile devices was just not really there. So it wasn't really possible to do the kinds of things that you'd need to do meaningful EEG signal processing in real time on a smartphone of the day. Whereas now smartphones are so powerful that just about anything you would want to do with EEG can be done in real time. So that has really potentiated a lot of new capabilities. You can do some pretty sophisticated signal processing analysis on the coprocessor or on the main processor on a smartphone, and that enables you to do just anything you would want to do on as many channels as you want in a mobile device like an iOS or an Android device. In fact, where the limit really comes in is in transmitting data. So the only hard limit is Bluetooth bandwidth on iOS, and that's what constrains the number of channels you can have in a mobile EEG device. The other big change that's come along has been material for, so the cost of manufacturing headsets has come down a lot, and the electronic components and amplifiers that go into mobile EEG headsets has really come down. And material science has gotten a little bit farther along to the point now where we screen print the silver electrodes onto the forehead sensors of Muse, and the ear sensors, which are conductive polymer, can be coated with some really conductive materials to really get that bioimpedance down and improve signal quality in very significant ways. So we're constantly working with materials companies that are doing cutting edge stuff on this to get the latest coatings onto our devices and flexible electronics into the band in new and interesting ways.
Any thing in particular that you could talk about that is coming online with that's maybe a new model or just some improvements to the one that you guys have?
Yeah, we've actually been working. So there are a number of different ways of looking at how EEG and brain-computer interfaces can go. And I think what's really going to happen is that the industry is going to continue to diverge along the lines of high fidelity versus high portability. So high fidelity systems, you're always going to be able to do better with a lot of channels. There's a diminishing return once you get beyond a certain number. Like, you can go, when you go from 20 to 32 channels, there's a big improvement. When you go to 64 channels, there's another improvement. But then, every increasing number of channels after that, there's a cost imposed in setup time. So there's no optimal number of EEG channels. It really depends on what your application is, what kind of fidelity, whether you want to do EEG source localization as part of your neurofeedback. The direction we're going in is the other one, which is to say, how can we get this into the hands of as many people as possible in a way that doesn't make them look weird and that they won't have any kind of qualms about wearing either in public or much more regularly. So we're looking at a device that people can use at home every day. Or even on the fly or out in the world, that they can put this on with relative ease and that they won't draw stares if they don't want to. There's some small number of users who really like the idea of having a weird looking thing on their head. But and it's not that weird looking. Muse is actually quite a beautiful device, I think, but it still draws attention to the wearer. The next big thing that's coming along is the Smith Lowdown Focus, which is a pair of sunglasses that we've made in partnership with Safilo, a big Italian eyeglass manufacturer and the parent company of Smith. So this is an ordinary pair of Smith Lowdown sunglasses, with Muse built in. So you've got everywhere that it touches your skin, including, and I'll apologize for the white nose piece on here. This is a prototype, but so both parts of where it touches your nose, and then one over the nose bridge here, and each ear sensor is an EEG electrode. So from that, we can do a lot of the same things that Muse does. We get slightly different noise characteristics, but interestingly, we've managed to enhance the coatings on this so that we're getting really good bioimpedance and really good signal quality out of something that is just a conductive polymer and a very, very comfortable pair of sunglasses, I might add. So this, all of the electronics fit into the arm and the batteries in the other arm. And in addition to EEG, we can add a bunch of environmental sensors like step counting, accelerometry, UV sensors, pressure, temperature, etc. So you can do, while you're recording EEG, you can do other interesting things like pull a heart rate out of the accelerometer to see how, to use that as a biofeedback parameter if you want, or just to measure it.
Wow, that is really awesome.
Yeah, they're pretty cool.
Those are awesome. Is it going to be more of, it seems like, and correct me if I'm wrong, but Muse has taken more of a biofeedback route rather than brain-computer interface at this point. But do you feel like the glasses will be taking a similar path, or will it be sort of both?
There are definitely developers who work on Muse for active brain-computer interfaces, and there are people doing some interesting things. If you look at the neural drift application, it connects two Muses together, and two people can simultaneously, through collaboration, drive a remote control car. The challenge is that for active brain-computer interfaces, you really want more channels if you can get them. So a head cap is going to be a much better thing for an active brain-computer interface, like a control interface, than something very simple like a Muse. If you look at Torsten Zander's definitions of brain-computer interfaces, he distinguishes between active brain-computer interfaces, passive brain-computer interfaces, and reactive. And neurofeedback falls into the reactive category. So where I think we fit and where the future of Muse lies is in the passive and reactive brain-computer interface technology space, where the brain-computer interface can measure your cognitive state and adapt whatever environment it is, whether it's smartphone notifications or virtual reality or augmented reality, to the cognitive state of the user to optimize their experience, or can give direct feedback in the form of biofeedback to help them learn a skill or help them learn to self-regulate. So we certainly don't rule out active BCI. It's just not something that Muse is optimized for. All the leading research in active BCI is really on whole head systems, 32-channel systems for driving wheelchairs and things like that. And non-invasive stuff it's just very hard to do well with enough degrees of freedom to really make a meaningful BCI, even with a whole head system. So there are some very good systems out there that can be used for, like the emotive epoch is pretty good. Advanced brain monitoring is pretty good. Neuroelectrics is really good too. And we don't necessarily want to compete in that space. We feel like there's enough potential in the neurotechnology market for everybody to grow in their own ways.
Yeah, absolutely. I was hoping you'd be able to tell me a little bit about what the research process looks like when you're designing algorithms for neurofeedback. Are you having subjects sit there and report subjective experience and sort of break down the EEG data that's coming back, or how does that process look?
It's a great question. So when we started out, we were looking at traditional bands in neurofeedback like alpha, beta, theta, delta, and we were trying to pull insights out of those in the way that traditional neurofeedback did it. And there are some powerful insights. You can get very reliable, traditional EEG band information in real time out of Muse. So if you look at the literature on teaching meditation or teaching neurofeedback, there's some powerful numerical and computational techniques for developing a calibration and a classifier on those. So we started from the literature. Mm-hmm. And then we figured out what it was we wanted to teach, which was, in this case, meditation. So, it's a technology-assisted meditation, really. Yeah. And there's a much sparser literature on that. So we started to do some in-house research. We have a couple of meditation teachers on staff, and I myself have some training in cognitive psychology. We have a number of collaborations with cognitive psychologists and researchers in the field. And we started to set up experiments in-house where we would have meditation teachers come in and guide people through a breathing-focused meditation, 10 at a time, collecting data with prototype muses or in the early days and now with regular muses. And so we'd be measuring brain states in guided meditations. We recapitulated a lot of the classic experiments like Lost in Thought, where subjects had probes for mind wandering. And we looked, when we had enough data, we did this on about 150 people the first time. We went in and did some machine learning on the EEG. So we had labeled data from guided sessions, we had labeled data from mind wandering sessions, and we trained classifiers on that basis. So we do a lot of signal processing and machine learning in the company, and that was how it started. Then when we got the app out and we started our research program, so if you have a Muse app, you'll notice after about the second or third session, it asks you if you want to share your data with the Muse research team to help improve the Muse algorithm and help scientists understand a little bit more about EEG. So when people got involved in the research program, for a while, and to some extent we're still doing this, we were sending them different paradigms and different kinds of algorithms and feedback to try out through the app. And we were getting their feedback on how they worked, whether they liked it or didn't like it, whether they felt it was accurate or more accurate or less accurate. And then we were constantly improving the algorithm on that basis. So one of the things you notice if you look at where EEG signal analysis has gone, especially if you look at like the signal processing and machine learning community, is there are definitely some elements of the traditional EEG neurofeedback bands that fall out of machine learning competitions and challenges. But there are a lot of things that are very non-traditional that look nothing like, alpha Z-score neurofeedback. Some really interesting measures that fall out. And so if you open up the field if you open up your data and you look at it in a naive way, in a sense, you try to build an unsupervised classifier for it, some really interesting things fall out, and you can use those as long as you've got enough good data to build really interesting classifiers and improve the algorithm consistently and generate new insights.
So it sounds like to me the technology now that we have to read brainwaves is almost reteaching us how to use them. It's almost like you're seeing more data that people in the past 100 years that have been looking at brainwave data haven't even been looking at. That's amazing.
Yeah, well, to give you an idea, there was some. We recently had a paper come out with some of our collaborators in the neuroscience department at McMaster University up here in Canada, in which we looked at the first 6,000 or so users who signed up for Muse back in 2014 when we first released to our Kickstarter backers. And what we saw in those data was stuff that had been hinted at in the literature, patterns that, differences between 60-year-olds and 20-year-olds that had been reported but were sort of underpowered from a statistical perspective. When we looked at 6,000 people, very, very clear trend lines came out. The statistics became very robust. So we're not only generating new insights about how to use the EEG that's coming off of the Muse in ways that that the users can enjoy. We're generating new insights about how the brain changes with age, about how it changes with neurofeedback training, about gender differences, and we're digging into even more of that now.
That's awesome. I was just I just got off the phone with Jackie and Ben from Interaxon. I was talking to them about some other things, and they mentioned that you guys might be having some sort of provider platform. Would you be able to talk about that at all?
Absolutely. Jackie and Ben may have told you that one of the things that surprised us maybe most about the user base, our user base, and the growth of the user base of Muse is that a pretty significant and growing number of purchasers of Muse and of our users are either mental health clinicians themselves or the patients of mental health clinicians who've been recommended Muse as a way of teaching them mindfulness. So we know that meditation and mindfulness are increasing in popularity and utility as a tool in mental health. And it's a very, very powerful technique for treating some mild and moderate symptoms. So the challenge there is really accessing, mindfulness in a way that's engaging and builds a habit. So one of the things we did was we went back to these clinicians who were using Muse and recommending it and said, okay, you obviously find some use in this and some utility. What can we do to make it even better for you? How can we make it easier for you to use with your patients to get them motivated and to keep them using it? So we built a series of tools like a dashboard for clinicians to request their patients' usage data. And what that does is gives you an adherence kind of a bit of information about a patient's adherence to a mindfulness program, like how much are they doing it per week? How are they doing at it? Are they struggling with it? Are they falling off? And just having that interaction between patients and clinicians can be a really, really powerful motivator to keep people at the practice. So we see a much higher rate of adherence to a program and to goals in people who are supervised by clinicians using Muse than we do in the rest of the user base. So there are some really interesting things about the way that the clinician-client relationship, the professional-client relationship in mental health, that seems to motivate people to use Muse even more effectively. And we're seeing anecdotally, we're starting to see some really good results. People are saying this is really improving my quality of life, or clinicians are saying my patients are really getting better in certain circumstances. On our board, we have Norman Doidge, who is the author of The Brain That Changes Itself, pretty well-known psychiatrist. So he recommends Muse to some of his patients he think would benefit from it. And he says he sees pretty positive results initially for these people. It's certainly not a panacea. Mindfulness is not a panacea, but it's a powerful tool in the clinician's toolkit. And what we want to do is make it as easy as possible for clinicians to be able to use Muse with clients for whom it's appropriate.
Yeah, I think it'd be absolutely a positive, powerful tool. Just getting people in the habit of mindfulness alone, I think, would be amazing. And then also just getting people excited about being able to see their own brainwaves and getting interested in neuroscience and mindfulness in general.
Yeah.
I know in my own experience, just like I said, people getting their hands on it, looking at it, experimenting with it. It's almost like the individual person gets to be a part of something that you guys have really pushed so far forward. And I really appreciate you doing this interview with me. I had a lot of fun, and thanks for showing me the glasses as well.
It's my pleasure. If I can make a couple of recommendations.
Yeah.
If you do have a Muse or you're interested in trying one out, there are a couple of great apps out there that go beyond the Muse neurofeedback experience. One of them is Muse Monitor, which I know that some of the clinicians at Walter Reed, where you are, use for capturing data and visualizing it. That gives you better access to the raw data. We also have free research tools in a software developer kit. And recently, a group of developers who are affiliated with us released a course called EEG 101 that teaches users how to put the Muse on, what the signals mean, what they tell you about the brain, and a little bit on the history of EEG in a really interactive and engaging way that we think has some pretty powerful implications for teaching psychology and neuroscience. And some teachers and university professors are starting to use it to get their students engaged in understanding the brain. So there are some great apps out there to try with Muse, and I'd recommend you try them if you have a chance.
Yeah, that's awesome. I definitely will.
Okay.
Thanks so much, Graeme. Really appreciate it.
It's my pleasure. Feel free to get in touch with me if you have any other questions, or check out our research website for some of the latest stuff.
Wow, so that was a lot of fun. 3 main things I took away from talking to Graeme. Number 1 is that these personal EEG devices have come so far in the last 10 years. It was really interesting to hear his perspective on why that's happened. Number 2, they're really changing the game in terms of research and development with EEG. The widespread use of these devices allows the data to be sent to Interaxon, pulled, and analyzed by using things like machine learning to pull things that we did not even know about EEG before out of the data. We're literally rewriting the history books with EEG Research. Number 3 was how pervasive this technology is getting. I mean, did you see those sunglasses? Those sunglasses had an accelerometer, a blood pulse monitor. It had the EEG. It was all right there in the sunglasses and very discreet. So I think that what we're going to be seeing in the future is this technology finding its way into all types of devices that we're using. All right, thanks so much for listening. Again, please subscribe. When you subscribe to this channel, it really allows Tech for Psych to get interviews with prominent people like Graeme Moffat, so that we can talk about this neurotechnology and really inform you, the viewer, about what's going on in the world of neurotechnology. We've got relationships budding with Stanford University, American Psychiatric Association, and companies like Interaxon to bring you more content like this, because the field is moving so fast that there needs to be central locations that literally just focus on neurotechnology. So again, thanks so much for supporting Tech for Psych and subscribing to this channel. It's Dr. Cody Rall. Talk to you again next time soon.